Thank you for taking the time today to come learn about your newest employee benefit, Kavira Health. Starting January 1st, Kavira Health is going to be provided to every employee who's enrolled in your employer's group health insurance plan, and your family will also get full access to your Kavira membership. A couple quick items before we get started today. First off, this is meant to be a high-level overview about this service at Kavira. You'll also be receiving additional information around your start date, and I encourage you to check out our website at www.kavirahealth.com to learn more about the service provided and other great perks about being a member with Kavira. The other item is Kavira is not replacing your health insurance plan. So again, those who enroll in the group health insurance plan, you'll also get access to Kavira as an added coverage to help with those everyday care needs that come up and making it more convenient for you and your family. So to get started, Kavira is a membership-based primary and urgent care clinic that provides everyday medical care through both virtual visits and in-person house visits and workplace visits. As mentioned earlier, this membership is being fully paid for by your employer, so you and your family receive free, unlimited access to our service at Kavira. Really, our goal at Kavira, our mission, is to make everyday care as affordable, accessible, and convenient as possible for you and your family. And just to spend a quick minute talking about the problem that exists today and why Kavira is being added to your benefits package. The problem is really, if we're being honest, the traditional system of going to whether it's urgent care, the minute clinic, sometimes the ER or doctor's office for your everyday care needs is just not a great system. It can get really expensive with the premiums, the co-pays, and out-of-pocket costs. And then the experience itself, figuring out when can you get an appointment scheduled? Is it going to have to be scheduled out a week in advance? When do I take time off work? When do I pick my child up outside of school to bring them to the clinic? So because of these inconveniences, half of us struggle to access care. And that's where Kavira really comes in, is to help out with those everyday care needs that come up for you and your family. And here's how it works. So Kavira takes the digital front door approach, meaning every visit with Kavira starts by reaching out to us through our online or mobile app. We also have a clinic phone number that members can call or text as well to receive care if you don't have a smartphone. And through these virtual visits, we're able to diagnose, treat, and prescribe. And because of how easy it is to be treated virtually by Kavira, whether it's through messaging, video chat, or phone call, I always tell members that it's like you have a provider on speed dial in your pocket at all times. Next, and here's the really unique part about this benefit that you'll have access to starting January 1st. When in-person care is determined to be the best course of treatment, we will actually send a provider to come care for you or a family member at your house or meet you at the workplace. At your house or at the workplace, we can do most things you would get in a traditional primary or urgent care clinic. Think of those things you really do need in-person care for. For example, a rapid strep test, a rapid flu test, a COVID test, an ear infection scope for a child, blood draws, other types of labs, physicals, and even x-rays. And finally, we are membership based. There's a number of really great perks about being a member to Kavira for you and your family. As a Kavira member, you get access to 30 of the most common labs completely free to you and your family, and thousands of other heavily discounted labs. You also get access to over 350 free and discounted generic prescriptions. Some of these are provided by delivery, some of them are for pickup at the pharmacy, and we also offer that in-home imaging available as well. I'll cover off on more detail in terms of some of these services later on in the presentation, and there's a lot more information available at our website as well. But just to summarize how it works at Kavira, so when you as an employee or family member have an everyday care need come up, you reach out to Kavira and we'll either treat you virtually or we send someone to care for you in person. So let me give you a quick example of how this would work. Imagine one day your child wakes up with a sore throat and fever. You would reach out to us through the app, tell us what's going on. Our team would say, that sounds like strep throat, but let us send a provider to come take a closer look. Our provider would then come and care for your child in the living room. In the living room, they'd administer a rapid strep test, and if your child does have strep throat, they get medications later that same day. Now, the really cool part about Kavira, which I mentioned earlier, is the family coverage. So, as an employee who's getting your membership covered by your employer, your spouse and children under the age of 26 also get access to your Kavira membership. So, even if you're on employee only coverage from your company's medical plan, your spouse and children under the age of 26 also get access. So, using that example of strep throat, if your child has it, very possible you or someone else in your family have it as well, and you just don't even know it yet. Our provider during that same home visit would then administer a rapid strep test to you and the other family members. And if someone else has strep throat, they get a prescription written at that same time as well. So if you consider the alternative of one day find a time to bring your child to the clinic, 2 days later you start feeling sick, you need to find a time to go to the clinic. You can see really quickly how you're saving both time and money utilizing your Kavira membership. All right, I've been saying day-to-day care needs and everyday care needs during this call so far, but I want to spend an extra minute talking about what are those things we're actually treating at Kavira. A lot of acute conditions, things that someone in the family wakes up feeling sick, you want to be seen right away, so you might end up going to urgent care or a minute clinic, for example. Those are the types of things Kavira often treats in the acute conditions category. A really unique part about this service at Kavira as well is our ability to treat mild to moderate chronic conditions. And the reason we're able to do this is all of our Kavira care team members are local Minnesota, Wisconsin, and North Dakota based providers. So you can work with the same person over time for things like prescription refills, lab work. If you need to work on an individualized wellness plan, you can get more of that ongoing chronic condition management with your Kavira care team. We also do a lot of preventive and wellness care as well, things like your annual wellness exams, sports physicals for children, and we do offer the in-home imaging in a non-emergency basis. You can also learn more about the list of services covered by Kavira at our website, kavirahealth.com/services. And what we're most proud of at Kavira is the convenience this is bringing to our members. It's true, when you remove the copays, the insurance hassles, and surprise bills and provide convenient care where it's actually easy for someone to receive it, people truly do appreciate it. I highly encourage you, starting January 1st, when your Kavira membership is active, when you or a family member have an everyday care need come up, make Kavira your first call. We'll either be able to treat you completely free from the comfort of your own home virtually or through a home visit, or if it is something outside of our scope of care, we can get you pointed in the right direction for where to go to receive care. All right, so far I've spent most of the time talking about what is included in your Kavira membership. It's really important to touch on a few things that are not included as part of your Kavira membership. Care that can't wait 1 to 2 hours or emergency services. If you reach out and are describing emergency symptoms, things like shortness of breath, chest pains, our team will still send you in and refer you in towards urgent care or the ER to be seen more promptly. We also do not provide specialty care like orthopedics at Kavira. We do not administer vaccines. Our team is unable to prescribe controlled substances. We also do not do things like a pelvic exam, mammogram, and we're not a full replacement for a pediatrician. We can absolutely treat children 6 months and older for acute conditions that come up, but things like well child visits, you'll still want to go in and see your pediatrician to have that taken care of. The last thing I'm going to mention here is our hours of providing care. We're available for home visits and virtual care weekdays from 8 a.m. to 7 p.m. And on weekends, we're virtual only from 10 a.m. to 2 p.m. All right, that brings us to our last slide here of the presentation today. Some of the most common questions that come up, I'm going to go over. And if you do have other questions, again, I highly encourage you check out our website. The information is available on the URLs on the screen, or also reach out to your HR team with questions, and we'll get in contact from the Kavira team to HR team to make sure you have all your questions answered so that starting January 1st, you and your family can get the most value out of this great new benefit that your employer is bringing to you. Okay, so some of the most common questions. Who in my family can use this? This is being provided, your Kavir membership, to all employees enrolled in your employer's group health insurance plan. And even if you elect employee only coverage, your spouse and children under the age of 26 get full access to your Kavira membership. Who are my providers? These are primarily nurse practitioners, physician assistants, and RNs are going to be providing care with a few doctors on our medical advisory board. How do I learn more about the free and discounted labs and prescriptions? Please visit our website at kavirahealth.com/labs and meds to learn more about those broken down by condition, and we'll also be providing a handout closer to your start date. What is Kavira's service area? You can also view that on our website. Lastly, how do I access Kavira? So on your start date, you'll be receiving a welcome email, soon followed by a brochure and text message welcoming you to the service and more information to get started. At this time, you'll be able to download the Kavira app, or you can always call or text our clinic if you don't have a smartphone. We highly encourage you on your start date, download the app, create your account, fill out your medical history form, and that way, when a care need does come up, you can be seen right away to receive that care. Again, thank you for taking the time to learn more about this benefit, and we're really excited for you to get started on January 1st.